If you're over 60 and taking medications every day, this is something you need to hear. Some of the pills you trust could be quietly increasing your risk without you even realizing it. We're talking about serious problems like heart issues, dangerous falls, and even memory loss. The most worrying part? Many people never see it coming. Everything feels normal until it's not. So before you take your next dose, take a moment and watch this. It might change the way you look at your medications forever. As we get older, our bodies don't work the same way they used to. The liver and kidneys, which are responsible for breaking down and removing drugs, begin to slow down. This means medications can stay in the body longer than expected, and when that happens, the risk of side effects increases without any warning signs. And many seniors take multiple medications every single day, often prescribed by different doctors. This is known as polypharmacy. At first, it may seem normal, even necessary. But studies have shown that taking multiple medications can increase the risk of dangerous drug interactions, unexpected hospital visits, and serious health complications. The problem is, these risks are often silent. You may feel fine until suddenly something goes wrong. Some pills that are considered safe for younger adults can behave very differently in older bodies. And that's where the real danger begins. In recent years, doctors and heart specialists have started raising concerns about certain medications, especially when used by older adults. Medical guidelines in the United States are now placing more focus on age-related risks, particularly after 60 or 65. Yeah, these are not random warnings. They are based on years of research and real patient outcomes. Many experts now agree that some commonly used drugs can become risky as the body ages. But here's the important part. This is not about creating fear. It's about awareness. Doctors are not saying to stop medications blindly. Instead, they are encouraging patients to understand what they are taking and why. Because the truth is, a pill that helped you 10 years ago might not be the safest choice today. And making small, informed changes could prevent serious health problems in the future. Pill number 1. Example, sleeping pills/sedatives. Let's start with one of the most common types of medication, sleeping pills. Many seniors take these to deal with insomnia or restless nights. At first, they seem helpful. You fall asleep faster, and nights feel more manageable. But after 60, these medications can become risky. They slow down brain activity, and in older adults, this effect can be stronger and last longer. This can lead to morning drowsiness, confusion, and poor balance, and that's where the danger comes in. Studies have shown that these pills increase the risk of falls, which can lead to serious injuries like hip fractures. In some cases, they may even affect memory and thinking. What feels like a simple solution for sleep can quietly turn into a bigger health risk. And many people don't realize this until something goes wrong. Pill number 2. Example, strong painkillers/NSAIDs. Next are common painkillers, especially those used for joint pain, arthritis, or back problems. These medications are widely used and easily available, and so many seniors take them regularly without much concern. But after 60, the body becomes more sensitive to their effects. These drugs can irritate the stomach lining, increasing the risk of ulcers and internal bleeding. They can also affect kidney function, which is already weaker with age. But one of the biggest concerns is their impact on the heart. Some studies suggest that long-term use of certain painkillers may increase the risk of heart attack or stroke. The scary part is that the damage builds slowly over time. You don't feel it happening. You just keep taking the pill, thinking it's helping. Until one day, the risk becomes real. Pill number 3. Example, anticholinergic drugs. allergy/bladder meds. Now let's talk about a group of medications that many people don't even realize can be harmful: anticholinergic drugs. These are often found in allergy medicines, cold treatments, and even bladder control medications. They are very common, especially among older adults. But here's the problem. These drugs affect the brain by blocking certain signals, and in seniors, this can lead to confusion, memory problems, and even long-term cognitive decline. Research has linked prolonged use of these medications to an increased risk of dementia. The effect is not immediate. It builds slowly over time. You may start noticing small changes: forgetfulness, difficulty focusing, or mental fog. And most people never connect it to the medication they are taking. That's what makes it so dangerous. It feels harmless, but the long-term impact can be serious. Pill number 4. Example: blood pressure meds. Overuse/high dose. Blood pressure medications are essential for many seniors, and in most cases, they save lives. But problems can arise when the dose is too high or not properly monitored. As the body ages, blood pressure can fluctuate more easily. Taking strong doses may cause it to drop too low, especially when standing up. This can lead to dizziness, fainting, and sudden falls. Imagine getting up in the middle of the night and losing your balance. For older adults, a fall can mean hospitalization, fractures, or long recovery periods. In some cases, overly aggressive blood pressure control may even reduce blood flow to vital organs like the brain. That's why balance is so important. The goal is not just lowering numbers, but doing it safely. And without regular review, even helpful medications can become risky. Pill number 5. Example: acid reflux drugs, PPIs. Finally, let's talk about one of the most commonly used medications: acid reflux drugs, also known as PPIs. Millions of seniors take these daily for heartburn or stomach issues. They are often seen as harmless and are sometimes used for years without a second thought. But long-term use can lead to hidden problems. These drugs reduce stomach acid, which is important for absorbing key nutrients like calcium and vitamin B12. Over time, this can weaken bones and increase the risk of fractures. Some studies have also linked prolonged use to kidney issues and infections. The most surprising part? Many people continue taking these medications even when they no longer need them. What started as a short-term solution becomes a long-term habit, and that's where the risk quietly grows. Before you make any changes, it's very important to understand this clearly. Do not stop any medication suddenly. These medicines are not bad for everyone. In many cases, they are necessary and even life-saving. The risk depends on several factors, including the dose, how long you've been taking it, and your overall health condition. What may be risky for one person could be completely safe for another. That's why personal medical advice matters. Stopping a medication on your own can sometimes cause more harm than good. The goal of this video is not to scare you, but to help you ask better questions. If something feels concerning, talk to your doctor. A simple conversation could make a big difference in your long-term health and safety. So what can you do to stay safe? The first step is to review your medications regularly. And don't assume that what you started years ago is still right for you today. Ask your doctor simple but powerful questions. Do I still need this medication? Is there a safer option available? Can the dose be reduced? These questions can open the door to better and safer care. It's also important to avoid self-medicating, especially with over-the-counter drugs. Many people think they are harmless, but they can still interact with other medications. Keeping your routine simple is often the best approach. Fewer medications taken correctly are usually safer than a long list of unnecessary pills. Small changes can lead to big improvements in your health. After 60, your body is not the same as it was before. It reacts differently, processes things more slowly, and becomes more sensitive to medications. What worked for you in your 40s or 50s may not be the best choice today, and that's completely normal. The goal is not to avoid medications altogether, but to use them wisely. It's not about taking more pills, it's about taking the right ones. Being aware of the risks can help you make better decisions and avoid serious health problems. Sometimes, the biggest danger is not what you feel, but what you don't notice. And that's why awareness matters, because a small change today could protect your health for years to come. Now, I want to hear from you. How many medications are you currently taking every day? You might be surprised at how common this is. Share your answer in the comments below. Your experience could help someone else realize something important. And if you found this video helpful, make sure to like it and subscribe to the channel. We're here to make health simple, clear, and easy to understand, especially for seniors. Every video is designed to give you practical information you can actually use in your daily life. So, stay connected, stay informed, and take control of your health one step at a time. This content is created for educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Every individual is different, and medical decisions should always be made in consultation with a qualified healthcare provider. If you have concerns about your medications or health condition, please speak with your doctor or pharmacist. Never start, stop, or change any medication without proper guidance.